Let's talk about science-based ways to lower inflammation, the things that you can start doing right now. And I want to put the emphasis on human clinical trials because that's most relevant for us. And to be clear, we're talking about chronic inflammation, which is that low-grade inflammation that occurs even though you don't appear to be sick. Chronic long-term inflammation is associated with a number of health conditions ranging from diabetes and heart disease to cancer. And you may have even heard the term Inflammaging, which is a reference to how chronic inflammation may even be implicated in the aging process. Inflammation does tend to increase as we get older, but some of this also seems to be due to lifestyle choices, which is good news because it means we have some control over this process. And if you really want to know if any of these strategies are working for you, the only way to really know for sure is to get a blood test before and a few months afterward. And the things you want to test for are C-reactive protein, CRP, and also Interleukin 6, also known as IL-6. Both of these are pro-inflammatory markers, and between the two, you could make an argument that IL-6 is probably the better test to get because it's one of the most potent increasers of CRP. Okay, so what are some things to lower chronic inflammation? Well, it turns out that there's over 50 different clinical trials out there showing that being overweight is associated with more inflammation. And so it stands to reason that if we lost weight, inflammation would indeed go down. When researchers followed people for 2 years who had cut their calories by 25%, they found that not only did people lose about 15 pounds, but there was also a 40% drop in C-reactive protein levels and a 50% drop in TNF-alpha. Tissue necrosis factor alpha is another pro-inflammatory marker that scientists sometimes measure when they do this type of research. However, what's weird about this study is that Interleukin 6, that potent booster of CRP I mentioned a minute ago, it didn't go down in the study. If your cholesterol is elevated, there's a good chance you also have some chronic inflammation going on too. And this also appears to apply for having higher LDL levels as well. So lowering cholesterol, either through lifestyle modifications or medications if necessary, is definitely something to take a look at. By the way, some of the things we'll be talking about in this video also lower cholesterol and LDL too, so that's a win-win. Several studies have also shown that moderate intensity exercise also has an anti-inflammatory effect on the body. And this also appears to be true for both aerobic exercise like walking as well as resistance exercise like strength training. And this effect has even been shown in older people who exercise too. And it gets better still because the anti-inflammatory effects of exercise seem to occur even if you don't lose any weight. Some foods you eat may also be ramping up inflammation. For example, in this clinical trial, women who ate more red meat and processed meat had higher inflammatory markers. In general, foods that contain added sugars, refined carbohydrates, and fried foods, they're going to jack up inflammation a lot. Rule of thumb, if the food comes in a wrapper or a box or you got to go through a drive-through to get it, it's pro-inflammatory, and this style of eating seems to be associated with some pretty bad side effects. For example, increased risk of breast cancer and prostate cancer, reduced kidney function, lung function, more heart disease, and greater likelihood of passing away from heart disease as well. And maybe even shorter telomeres, which would indicate that you might be aging quicker than you really should be. Conversely, fruits, vegetables, beans, and seeds, they have anti-inflammatory effects. And this anti-inflammatory effect of a plant-based diet may be one of the reasons for the health benefits of the Mediterranean diet. Eating healthier is also associated with a lower production of advanced glycation end products, which are molecules which increase free radical production of the body and also, you guessed it, ramp up inflammation too. And I'll link below to my video on advanced glycation end products so you can learn more about that. Obviously, plant-based foods contain fiber, and when the healthy bacteria inside of us eat that fiber, they produce compounds called short-chain fatty acids. One of the short-chain fatty acids that are produced by the microbiome when they eat fiber is called butyrate. And one of the things that butyrate does is lower inflammation. Oddly, when I looked into this, I saw clinical trials where they were giving people butyrate supplements, which I thought was really weird because we make this stuff just eat more fiber. Oh, and on a related note, eating more fiber might not just lower inflammation, it may also help depression as well. One pretty easy way to lower inflammation that I would bet most people had probably never heard of before, and that is moisturize your skin. In this study, 63 older adults were treated with either a skin cream for 30 days or received no treatment, and those receiving the treatment only used 3 milliliters twice a day. Results here are pretty impressive. Inflammatory markers, including IL-6 and IL-3, were reduced to levels seen in that of younger people, and there was a 40% drop in TNF-alpha, again showing that simply moisturizing your skin seems to have an anti-inflammatory effect. Curcumin is one of the curcuminoids found in the spice known as turmeric, and it has been shown to lower C-reactive protein, IL-6, and other markers of inflammation too. Although scanning the research, not all studies show curcumin actually is effective. For example, in this review, neither curcumin or turmeric was effective at lowering inflammation in people with chronic inflammatory disorders. However, in this other review involving 66 clinical trials, both curcumin and turmeric were found to reduce C-reactive protein, IL-6, and TNF-alpha, and as an added bonus, it also promoted significant increases in a very powerful antioxidant enzyme called superoxide dismutase. Now, if neither turmeric or curcumin is working for you, another option may be ginger. In this review involving over 1,000 people, ginger was found to effectively lower C-reactive protein and TNF-alpha, although oddly, ginger did not appear to significantly reduce interleukin-6 levels. Good news if you like garlic. In this review of 10 clinical trials, it was found that just eating 2 grams of garlic a day reduced C-reactive protein and TNF-alpha levels significantly. However, oddly, this study also showed that garlic did not reduce interleukin-6 levels. Something else about this study that is worth noting is that these researchers also pointed out that garlic powder had no anti-inflammatory effects whatsoever. So between the two, eating garlic is probably your better bet. Now, if you are thinking about a supplement, one that's worth taking a look at is called aged garlic extract. In this clinical trial of healthy overweight adults, aged garlic extract supplements significantly lowered IL-6 and TNF-alpha after just 6 weeks. Vitamin B12 might be a quick and easy way to lower some inflammation, especially in older adults who, according to some reports, may not be absorbing enough B12. These researchers point out that those with higher B12 levels tend to have lower CRP and IL-6 levels, indicating lower inflammation. Now, that is encouraging. However, what I just told you is an association. In other words, it doesn't prove cause and effect. The only way to really know for sure if B12 lowers inflammatory markers is to give it to people for several months and measure things like C-reactive protein, IL-6, etc. And that study, to my knowledge, has not been done yet. When it does come out and it is published, I will do a video on it. That said, vitamin B12, B6, and folic acid are well known to lower a compound called homocysteine. Homocysteine is a compound we make sometimes that makes our blood cells sticky and it can damage blood vessels. And so it should come as no surprise that homocysteine is implicated in the development of heart disease. And I bring that up because elevated homocysteine is also implicated with more chronic inflammation. So making sure you're getting enough B6, B12, and folic acid from the food you eat and maybe some supplements may be something to take a look at, especially if your homocysteine is elevated. Nattokinase is an enzyme found in natto, and it's gotten quite a reputation as being a natural blood clot dissolver. And I'll link to my video on nattokinase below so you can see more about that research. There is some research that nattokinase may lower inflammation. However, the actual human proof, give it to people for a few months and measure their inflammatory markers, well, that appears to be lacking for the moment. Homotaurine has also gotten some attention. Homotaurine is a type of amino acid which you probably guessed looks like another amino acid called taurine. And as proof of its power, there is this paper which appears to show that homotaurine lowers inflammatory markers in people who have mild memory impairment. And that's nice. However, if you read the trial, you find out that they excluded people who had any inflammatory disease processes going on, which to me says the jury on homotaurine is still out. Now, something that may be worth taking a look at is fish oil and maybe fish oil supplements. So the fish oils, EPA and DHA, they do have a long history of being anti-inflammatory. For example, in this study, pro-inflammatory markers started to decline in people after they took fish oil supplements for just 4 weeks. Next up is Resveratrol, which is an antioxidant antioxidant and long reputed anti-aging nutrient, which is found in red grapes and peanuts and other foods. When researchers gave people with ulcerative colitis 500 milligrams of resveratrol, they found that it lowered not only C-reactive protein and IL-6 levels, but also another pro-inflammatory compound called NF-κB, and it did so after just 6 weeks of daily use. Studies like this one you're looking at appear to show that reduced vitamin D levels are associated with more inflammation, and that's encouraging. However, countering this is this paper where high-dose vitamin D supplementation did not significantly lower IL-6 or CRP levels in people with depression. Whether or not vitamin D lowers chronic inflammation, I think it's complicated and probably depends on what your baseline vitamin D level is. If it works, it probably works better if you're deficient. Switching gears, there's this paper on vitamin C, which appears to show that vitamin C can lower both C-reactive protein and interleukin 6, as well as fasting blood sugar and triglycerides when overweight people with diabetes used 500 milligrams twice a day for 8 weeks. Further reinforcing this is this paper, which reviewed 18 different clinical trials and also appears to show that vitamin C can lower interleukin 6. However, oddly, this same paper also showed that vitamin C didn't lower C-reactive protein. And if you're curious, the dosages used in all these different studies, they were all over the place, ranging from as low as 400 milligrams up to a whopping 3,000 milligrams a day, which I think is more than most people need. And if you're not a fan of supplements, here's some good news. There is this paper, which also appears to show that drinking 100% orange juice also lowers pro-inflammatory IL-6 levels. So the research shows that there are a variety of different ways that we have at our disposal for lowering chronic inflammation, and some of this research does in fact use supplements, which tells us that supplements can supplement what you are doing to improve your health. Now, that said, if I were to put my money on some things that I think would give you the best return on your investment, here's what they would be. Lose weight if necessary, don't smoke or vape, exercise moderately on a regular basis, limit your alcohol intake or don't drink at all, and eat a mostly plant-based diet. If you think I missed anything, leave a comment below and let me know and I'll take a look at it. Don't forget to like, share, and subscribe, and I'll see you next time real soon.